What causes moles to suddenly appear? Moles are very common, and most people have one or more. Moles are concentrations of pigment-producing cells, melanocytes, in your skin. People with light skin tend to have more moles. The technical name for a mole is nevus, plural, nevi. It comes from the Latin word for birthmark. The cause of moles isn't well understood. It's thought to be an interaction of genetic factors and sun damage in most cases. Moles usually emerge in childhood and adolescence, and change in size and color as you grow. New moles commonly appear at times when your hormone levels change, such as during pregnancy. Most moles are less than 1/4 inch in diameter. Mole color ranges from pink to dark brown or black. They can be anywhere on your body, alone or in groups. Almost all moles are benign, non-cancerous. But new moles in an adult are more likely to become cancerous than old moles. If a new mole appears when you're older, or if a mole changes in appearance, you should see a dermatologist to make sure it's not cancerous. Types of moles. There are many types of moles, categorized by when they appear, what they look like, and their risk of becoming cancerous. Congenital moles. These moles are called birthmarks and vary widely in size, shape, and color. About 0.2 to 2.1% of infants are born with a congenital mole. Some birthmarks may be treated for cosmetic reasons when the child is older, for example, age 10 to 12 and better able to tolerate local anesthetic. Treatment options include skin resurfacing, dermabrasion, skin shaving, excision of top skin layers, chemical peel for lightening, laser ablation for lightening. Risk. Larger congenital moles have a greater risk of becoming malignant in adulthood, 4 to 6% lifetime risk. Changes in growth, color, shape, or pain of a birthmark should be evaluated by a doctor. Acquired moles, also called common moles. Acquired moles are those that appear on your skin after you're born. They're also known as common moles. They can appear anywhere on your skin. People with fair skin can normally have between 10 and 40 of these moles. Common moles are usually round or oval, flat or slightly raised or sometimes dome-shaped, smooth or rough, one color, tan, brown, black, red, pink, blue, or skin-colored, unchanging, small, 1/4 inch or less, the size of a pencil eraser, may have hairs. If you have darker skin or dark hair, your moles may be darker than those of people with fairer skin. Risk. If you have more than 50 common moles, you're at a higher risk for skin cancer. But it's rare for a common mole to become cancerous. Atypical moles, also called dysplastic nevi. Atypical moles can appear anywhere on your body. Atypical moles are often on the trunk, but you can also get them on your neck, head, or scalp. They rarely appear on the face. Benign atypical moles may have some of the same characteristics as melanoma, a type of skin cancer. So, it's important to have regular skin checks and to monitor any changes in your moles. Atypical moles have the potential to become cancerous. But it's estimated that only 1 in 10,000 trusted source atypical moles turn into cancer. Because of their appearance, atypical moles have been characterized as the ugly ducklings of moles. In general, atypical moles are irregular in shape with uneven borders, varied in color, mixes of tan, brown, red, and pink, pebbled in texture, larger than a pencil eraser, 6 mm or more common in fair-skinned people, more common in people who have high sun exposure. Risk. You have a higher risk of getting melanoma if you have 4 or more atypical moles, a blood relative who had melanoma, previously had melanoma. If members of your family have a lot of atypical moles, you may have familial atypical multiple mole melanoma (FAMMM) syndrome. Trusted source. Your risk of melanoma is 17.3 times higher than people who don't have FAMMM syndrome. Causes of new moles. The cause of a new mole that appears in adulthood isn't well understood. New moles may be benign or they may be cancerous. Melanoma causes are well studied, but there's little research trusted source on what causes benign moles. Genetic mutations are likely involved. A 2015 research study reported that genetic mutations of the BRAF gene were present in 78% trusted source of benign acquired moles. BRAF mutations are known to be involved in melanoma. But the molecular processes involved in transforming a benign mole to a cancerous mole aren't yet known. The interaction of ultraviolet light (UV), both natural and artificial, with DNA is known to cause genetic damage that can lead to the development of melanoma and other skin cancers. The sun exposure can occur during childhood or young adulthood and only much later result in skin cancer. Reasons that you may have a new mole include increasing age, fair skin and light or red hair, family history of atypical moles, response to drugs that suppress your immune system, response to other drugs, such as some antibiotics, hormones, or antidepressants, genetic mutations, sunburn, sun exposure, or tanning bed use. New moles are more likely to become cancerous. A 2017 review of case studies found that 70.9% of melanomas arose from a new mole. If you're an adult with a new mole, it's important to have it checked by your doctor or a dermatologist.